Today we're going over the top 6 mistakes new retirees should avoid in 2025, but make sure and watch to the end because number 6 could ruin some retirements. But let's get right into it. The biggest mistake that we see people make is missing their Medicare enrollment window. Unfortunately, we see people make this mistake every single day, and it's one of the most costly mistakes that you can make. But when you're turning 65, Medicare is going to give you what they call your initial enrollment period. This is a time where Medicare says, hey, you can enroll into Medicare at this time and not have to worry about any late enrollment penalties. This initial enrollment period is a 7-month window that starts 3 months before you turn 65, your 65th birth month, and then 3 months after you turn 65. As long as you enroll during this time, you will never have to worry about any penalties. But if you're working past 65 and considering not taking Medicare right at 65, there's 3 things that you need to make sure are happening or you're gonna get penalized. The first is that you or your spouse have to be actively employed when you turn 65. The second thing is that you have to have group coverage through that specific employer. And then the third thing is that that employer has to have 20 or more employees for it to be considered credible coverage. If all 3 of those things are happening in your situation, then you can actually bypass Medicare during this period and take it once you actually decide to retire. Mistake number 2, assuming Medicare covers everything. A lot of people that we meet with have the idea that Medicare will just cover all of their bills once they get on it, but that could not be further from the truth. So how it's gonna work is you're gonna get this red, white, and blue Medicare card when you turn 65. It's your Part A and your Part B. In other words, original Medicare. Well, there's a deductible that's $1,676 per hospital stay on Part A. And then there's an 80%, 20% coinsurance on Medicare Part B. These are gaps in coverage that you absolutely have to be aware of. So think about it this way. If you only take out Part A and Part B, you know you're gonna roughly be out 20% of every single bill that you get. And that's where your 2 options are, Medicare Advantage or Medicare Supplement, of covering that 20% and making it more affordable. Which leads us into mistake number 3, which is picking the wrong plan. Like we said before, you're gonna have 2 options of making that 20% more affordable for you. You're gonna have Medicare Advantage and Medicare Supplement, and they could not be more different. So say you take out a Medicare Supplement Plan G, that's the most popular Medicare supplement in 2025. But how it's gonna work is you're gonna pay a premium based on where you live in the United States. And when you're turning 65, that premium is gonna range from about $130 a month up to $300 a month. But after you pay that monthly premium, the only out-of-pocket cost that you have on a Medicare Supplement Plan G is a one-time-a-year deductible, which this year in 2025 is $257. So you know if you pay your premium every month and that deductible one time per year, you have 100% coverage no matter what. But on the flip side of that, your second option is Medicare Advantage. And typically if you take one of these out, you're not gonna have any type of monthly premium, but you will have co-pays and co-insurance when you get things done, like doctor visits, hospital stays, and surgeries. Along with that, you're also gonna have some things built in at no additional cost, like drug coverage and dental, vision, and hearing coverage. So when you're turning 65, it is crucial to pick the right plan. And if you need help doing that, I've left a link down below in the comment section where you can book a free one-on-one call with me and we can go over the specific plans in your area. Mistake number 4, not reviewing your drug coverage. This is a massive mistake that we see a lot of individuals make, and it's because they get onto Medicare and they think that they don't have to do anything else, that they got on it and they're good to go. Which truthfully, that could not be further from the truth. So all these different Advantage plans and drug plans are allowed to change each year. They can take pharmacies out of network, they can take drugs off of the covered list, they can raise prices, lower prices. So it's extremely crucial that you review your plan each year to make sure that you're getting on the best plan possible every single year. I don't even know how much money we have saved our clients over the years by just reviewing their drug coverage with them every October through December of every single year. So if you're getting on a Medicare, do not think that it's just a one and done. You get on it and you're good to go. You need to review it every single year. Mistake number 5, ignoring IRMA. If you're not familiar with IRMA, it stands for Income Related Monthly Adjustment Amount. A lot of people don't know this when they're getting onto Medicare, but what you pay for your Medicare is strictly determined by how much income that you show 2 years in the past. So if we refer to this IRMA chart right here, you can see that there are different income amounts. And if you're single or you're married filing jointly, there are different income brackets that you have to stay within to decide how much your Medicare is actually going to cost every single month. This is extremely important to pay attention to in the planning process, because say that you're considering taking out money out of a 401k, or maybe you sell a house. That could bring you up to the next bracket where you have to pay more for your Medicare, and you need to budget properly for that. So make sure and take a screenshot of this video and save this chart for your record, because you need to pay close attention to it when budgeting for Medicare. And just as a reminder, they always look back 2 years when determining your Medicare premium. So if you're getting on a Medicare in 2025, they're gonna look at your 2023 income. Number 6, assuming employer coverage is better than Medicare. I see this mistake time and time again, and it seems like every time we're meeting with someone that has the option to stay on their group plan or take Medicare at 65, that they come into the meeting thinking that their plan is going to be leaps and bounds better than Medicare. It's about 70% of the time that we're meeting with someone, we find that Medicare is either 1, more affordable than their group coverage, or 2, more competitive than their group coverage. So if you're turning 65 and you actually have the option to stay on that group plan or take Medicare out and still work, I would highly suggest that you meet with a professional and go over the options with Medicare and compare them to your group plan. And once again, if you need help doing that, there's a link down below where you can book a one-on-one call and we can go over your group plan versus your Medicare options. Now, I know we went over a lot of information in this video, but I wanted to let you know, I've left 2 links down below in the comment section where you can book a one-on-one call with me and we can go over your specific situation. All of it is 100% free of charge. We never charge a dime for any of our services. And the second link is where you can go and get a copy of our 2025 Medicare planning guide for absolutely no cost. So take advantage of those links. It's 100% free of charge. Also, leave a comment down below on what topic that you want to see next. And don't forget to like, comment, and subscribe to our channel if you haven't already. And if you like this video, go watch this video right here where we go over the top mistakes people make when working past 65. I'll see you over there.